Hello and welcome to this week's episode of the Science or Fiction podcast, where we interview researchers to separate the science from the fiction in news headlines. I'm your host, Dr. Catherine Bates. I'm a youth development and mental health researcher at King's College London, and this is the Science or Fiction podcast. First, a content warning. In this episode, we discuss mental health issues, including depression, anxiety, self-harm, eating disorders, suicidal ideation, and psychosis. We've also included links to free helplines and support on our website, scienceorfiction.co.uk. Also, just to note that we're not talking about individual cases of mental health. Instead, we're talking about the research in general and what the evidence shows. The latest NHS figures show that in December 2023, nearly 750,000 children and young people were in contact with NHS mental health services. Reports from the previous year showed that young people waited on average between 2 weeks and 3 months to be seen by mental health professionals after they were referred. In a survey conducted with 14,000 young people by mental health charity Young Minds, they found that 58% of people they asked said their mental health got worse while they were waiting. The NHS is clearly not keeping up with the need for mental health support. Could social prescribing be part of the answer? So social prescribing involves connecting people with the community through activities like cinema clubs or nature walks. NHS England launched a social prescribing service in 2018 to link patients with non-medical support in the community. It's since been suggested that young people on waiting lists for child and adolescent mental health services, or CAMS, could be prescribed social prescribing. In a recent article published by The Guardian titled "Calls for Strategy on Social Prescribing in England Amid Youth Mental Health Crisis," the chief executive of Barnardo's Children's Charity said that it can turn children's lives around and that the government should commit more funding to the initiative. But what does the evidence show? Young people are often in crisis by the time they are referred for mental health support. Is there evidence to suggest that social prescribing can improve young people's mental health? So when mental health research is covered in the media or in news articles, this is often in short form content and with catchy headlines. We need to know more about the research findings to better understand our own mental health and how to support one another. Today, we're talking to Senior Research Fellow Dr. Daniel Hayes to find out whether social prescribing is the prescription for youth mental health. So welcome, Daniel. Thanks for joining us today.
Thanks for having me.
Just to get started, to understand a bit more about you, can you tell us what you do and potentially an unexpected detour that led you to your current job? So I think it's always nice to know how you ended up where you are.
Sure. So as outlined, I'm Dan Hayes. I'm a Senior Research Fellow based at UCL, and my background is predominantly in youth mental health. And in the team I'm in, it's investigating ways to help improve health and well-being for children and young people, with a focus on kind of cultural, social and community mental health. So what can we do within the community? And this can include things such as arts, nature, or exercise.
Brilliant. Go on.
Unexpected detour. So a little unexpected, I suppose. After I completed my psychology degree and I did a master's, I started working in psychosis for quite a while, but felt that the research the department was in at the time was very medical and kind of drug based. So I kind of left that area, not really knowing what I wanted to do afterwards, and then spent the next 4 years working in retail, trying to figure out what was next. And then during that time, I volunteered as a youth worker. And at the same time was a trustee within a charity, helping them kind of evidence impact and kind of data analysis, and found that I've really enjoyed those two things. So a job opportunity came up within a charity, very much looking at how to evidence the impact of support groups in the community for young people that had voices. And from that, I was successful and then started working in the field to really understand kind of more personalized ways that we can help support young people with their mental health and well-being and the impact that that might have on them.
Brilliant. Thank you for sharing. I'm really excited to talk about this kind of like community-based mental health, because I think we often, when we talk about mental health, we do think of like one person, or you think of it as an individual or within yourself. But yeah, I'm really interested to see how it fits into the community. So I guess some definitions. So what actually is social prescribing? And I've also seen the term link worker around. And can you explain what that means as well?
Sure. So social prescribing, in a nutshell, is kind of connecting people, in this instance, young people, to non-medical forms of support kind of within their local communities. It's not really a new approach. It's actually been around since the 1980s, but it's gained prominence in the last few years as NHS England wanted to roll it out as part of their personalised care package. And as a result of that, it's become kind of more in the public sphere. It started actually with older adults back in the 1980s, and this was based on some of the findings that 1 in 5 older adults were going to their GP for non-medical reasons, predominantly loneliness. And it was in response to a way of trying to support these individuals with non-medical needs to access support sources that might be appropriate for them. Since then, it's been shown to be quite effective in older adults, and then has since trickled down to adults and more recently young people. Activities, it's quite broad. It can include a wide variety of activities. There's kind of 4 overarching pillars that the National Academy of Social Prescribing refer to. One is to do with advice and signposting. This can be things such as advice on debt relief or housing. One is arts and heritage. So this can be engaging in arts activities or viewing arts activities such as, the ballet or theatre, and then kind of more cultural heritage activities such as going to museums. Then there's exercise, which is pretty self-explanatory, so playing sports. And then there's kind of more nature-based approaches, which we refer to as blue or green social prescribing. Blue is much more to do with water, and then green is to do with kind of, more gardening and nature. Okay,
brilliant. So just before I ask about some of those details, where does the link worker come in?
Sure. So the link worker kind of sits in the middle of a social prescribing pathway. So if you think about somebody like your GP or CAMS they refer to this person called the link worker or link worker social prescriber. This individual is employed in a wide variety of settings, often GP surgeries, but not exclusively. They're also based in charities, CAMS, for example, or third sector organizations. But they have a really good knowledge of the local area that they deal with in terms of what's available, what's not. They also have a good understanding of the social determinants of health and have skills around person-centered care. So what they do here is they talk to young people, in this instance, about their values, needs, preferences, what they think is wrong, what their unique gifts and talents are, and then from this co-produce a social prescription with the young person to then link them into the source of support in their community based off of their interests. The link worker can also accompany the young person to the activity to act as a bridge, which is kind of one of the main differences between that and something such as signposting, which any professional can do.
I see. Okay, so it's actually a lot more like involved with working together with a link worker rather than like, I think signposting was what I was more imagining, that maybe your GP or your contact at CAMS, should say Child and Adolescent Mental Health Services, kind of just suggests doing something and then it's up to you to go and do it. But it sounds like it's actually a lot more like you work with someone to figure out what you need and what you should do next.
Exactly, yeah. It's much more personalized. So a GP, for example, could say, oh, there's this football club, you might want to try it. But if the young person doesn't have an interest in football, that might be a problem. Whereas the link worker knows all of these little pockets of things that are happening in and around their local communities, and therefore is quite well placed or excellently placed to be able to refer them into these and support them with attending.
Yeah. It's interesting to know that those 4 different pillars are quite varied as well. Like, I hadn't realized that there was like a advice and support section of that. I think what you see mostly in like the news or the media is like young people are being prescribed like surfing and dancing on the NHS. Like, they don't seem to cover all these different facets of it.
True. I think given that it's quite new, we don't know all of the areas that may be more or less applicable. So when we're talking about advice, debt and housing debt, that might be applicable to young people, but much more is likely applicable to adults. What we're beginning to find with advice and signposting is it tends to be around more educationally based things, not exclusively, but for people potentially not in employment, educational training in terms of what to do next. But again, that is kind of towards the upper end of the young person age group.
That leads us quite nicely on to the next section. So in each episode, we dive into the evidence that's behind a headline. And in this week, we're discussing a report that you published last year in 2023 titled The Impact of Social Prescribing on Children's Mental Health and Wellbeing. And that was published with the National Academy of Social Prescribing. So firstly, what is the National Academy of Social Prescribing? Is that linked to NHS England, or what does that mean? And then also, can you summarise the main findings of the report for us?
Sure. So NASP is actually a national charity that champions social prescribing, and they support and connect people, communities and organisations so that more people in the UK can be involved in social prescribing for their health and well-being. As a result of that, they've got quite a lot of different arms or spokes that they're involved in, such as supporting grassroots groups, helping medical professionals implement social prescribing into their practice, champion social prescribing around the world, as well as influencing policy and working with researchers such as me to help build the evidence base. In terms of the review, they asked me to conduct a review last year into the impact of social prescribing on mental health and well-being. This actually followed off of a review that I conducted 2 years earlier, where we looked at the evidence base, but actually found that there wasn't an evidence base at that stage. And we posited different reasons for that. One was that it was quite new, but others were that actually social prescribing had just been adapted, had just been seen to be effective as an adult model and had been rolled out with youth settings, but not with regards to the nuances or implementation challenges in adapting it to work with a different group. So we conducted this updated review, which was published last year. We scanned the literature, and this included kind of academic literature and also what we call grey literature, which is kind of reports, poster findings, that type of thing. And at the end of it, we came up with 4 studies that met inclusion criteria. So 4 studies that looked at the impact of social prescribing on youth mental health and well-being. The studies were quite varied. So they were conducted in different settings. So one was in primary care, one was kind of in community settings, one was in the third sector. But what we were able to distill from this was that there was promising impact of the evidence for social prescribing on youth mental health and well-being. And what that means really is that there's promising signs, but at the moment it's still a bit too early to say definitively that it does work. This was mainly because the sample sizes were quite small, so there weren't tons of young people currently involved, which perhaps isn't unsurprising given that it's quite new, but also that there was no control groups involved, which makes it more difficult for us to know if it's really the impact of the social prescribing causing this, or if there's other factors that could be playing a part.
So ideally, you'd want to compare young people that were on a waiting list and receiving social prescribing, or you don't really receive it. So it's young people on a waiting list that are kind of a part of social prescribing compared to young people on waiting lists that are not, and that would act as your control group.
That's essentially what we're doing for Wellbeing While Waiting, which is the study we're currently running in CAMS for young people on waiting lists. The majority of studies in that review didn't focus on a CAMS setting, so there was no comparison group depending on the population that they were looking at. So, for example, accessing social prescribing through their GP versus not, or accessing social prescribing in the third sector versus not.
Okay, yeah. And 4 studies sounds like very few. But of course, this is kind of based on like theory around community and socializing and mental health and well-being. So I just wondered if you could touch on that a little bit as to why we think, or why you think that social prescribing can be effective.
We think social prescribing can be effective as it helps people access their unique gifts, talents, skills, and really empowers them to be able to do the things that they want to do with managing their mental health and well-being. So a lot of the time spent with the link worker is understanding what is important to them and why, and thinking around how they can access and support their mental health in an everyday setting via non-medical routes. So CAMS is important, and CAMS needs the resources to be able to effectively deliver treatment, particularly as you outlined before, prevalence in mental health for young people is increasing. However, access to CAMS is still time limited. So we need to better understand what we can do outside of CAMS to be able to support. And this could be early intervention, such as via GPs, but also post CAMS, really trying to incorporate a holistic approach to mental health and well-being. At the moment, or traditionally up until the 1990s, there was a very biomedical approach to mental health and well-being. We've now since seen that that's increased to a more biopsycho approach. And I think the social prescribing element really rounds it off with a biopsychosocial approach to mental health and well-being. So not focusing on one of these pillars, but incorporating all 3 to make sure that we can help support young people in the best ways possible.
The idea is that you're almost empowering the person, with the skills, the experiences, the community contacts to be able to approach their own mental health in a more like resourced way, so that even when they have also then gone through more formal support through a mental health service, they have these skills that they can kind of rely on in the future as well.
Skills and communities.
Yeah, and communities. Obviously, young people can be referred to mental health services for a range of reasons and a range of conditions or potential symptoms. So is social prescribing recommended to like all children and young people on waiting lists, or is it only those with certain symptoms, conditions? And can this vary like between different places?
The research that we're currently doing is quite novel with regards to looking at social prescribing within a secondary care setting. And when I mean secondary care, I mean child and adolescent mental health services. Predominantly, it's been based in primary care, so via GPs. So this way of looking at social prescribing is quite novel. It also means that we know less about it. So in terms of the study that we're currently running, we are not having many exclusion criteria on who can access social prescribing. And the idea is that we will then look at who accesses it and who it might be most helpful to. The current criteria that we have on exclusion is anorexia and psychosis. And the reason behind this is that these disorders are quite enduring and also quite severe. And we don't think that the evidence base is currently there to be able to justify using it with this group, given how new the field is. However, anybody else, providing that they don't have kind of suicidal, active suicidal ideation and intent, can access the study. So this can include young people with anxiety, depression, ADHD, some types of self-harm. And what we'll see is how it can help these different populations, and why.
And that you've kind of answered my my last question, because we're talking about your future study. But I guess what is next for research on social prescribing is an interesting situation, because as we've talked about, it's in the community and kind of like being recommended to young people. But as you've mentioned, the research is in its infancy. So what do you want to see kind of in the next 5 years in terms of research and the evidence base?
Sure. So just with regards to where we're at with the study, we've spent the last year recruiting the control group, so the people that couldn't access social prescribing because the pathways weren't set up yet. And in the meantime, we were developing the pathways with each of the services very collaboratively. So it was quite a bottom-up approach. So each pathway looks slightly different, although the overarching elements, so clinician, link worker, activity, is the same. We've now launched the social prescribing pathway formally, so we're now getting young people through the pathway, and we'll be running that for the next year. So results with regards to that, stay tuned. We are just about to launch our implementation manual. So we've got a lot of learning from phase 1 of the project, which was the pathway co-development phase, where we worked with clinicians, link workers and young people to kind of collaboratively develop those pathways. We'll be launching that in a few months' time. So then anyone that wants to develop their own pathways has a suite of resources to be able to use. In the next kind of couple of years, I'd really hope for us to be able to better understand who it works for, who it doesn't work for, and how it might be then offered alongside other types of treatment. As outlined at the moment, it's very much a waiting list project. So it's very much front-ended before young people get into CAMHS, but trying to think also, and by the time these individuals start treatment, they'll be engaging in those social activities. I think further research may want to focus on, once we know who it helps and how it helps, whether we can incorporate it into CAMHS more formally, so alongside treatment rather than at waiting list stage, and also potentially with regards to step down care, once individuals have been involved in CAMHS treatment, whether there is also benefits to a pathway which is kind of after the CAMHS journey to help incorporate young people back into the communities better.
So it's potential. I guess it has potential to not only be almost like a stopgap while you're on a waiting list, but to potentially be a part of ongoing care of mental health or young people's mental health, obviously depending on what the evidence shows imminently, so in the next year or so.
I think so. And I think CAMHS does need to be better resourced. This shouldn't be used as a stopgap. Some young people may be accessing CAMHS but may not want formal treatment, but have nowhere else to turn at the moment. This may be where social prescribing can be particularly beneficial in terms of the stuff we're looking at. That being said, I don't think it's going to be a cure for everybody, and that we need to very much understand that CAMHS need to be better supported, and this is just one arrow in the toolkit and shouldn't be used as the magic bullet to help everybody.
Yeah, I think that's a really important point to make, because definitely some of like the headlines that I've seen on this, like I mentioned earlier, like young people will be prescribed surfing for mental health, like that's unsurprisingly probably going to scare a lot of parents or teachers or whatever into thinking that we're not prioritizing like formal mental health support. So yeah, that's a really good point, that it needs to fit within like a broader framework.
Yeah, very much so. And I think it's very much about the personalization of care, which we kind of spoke about earlier. So it might be that some young people don't feel able to access these groups at the moment. It could be quite overwhelming if you've got anxiety to then be not forced, but actively encouraged to go to a group. It may be that you're actually better doing some art stuff on your own and building up to these groups later on. So it's very much about what works for the person, not a broad brush approach of, okay, you should attend this community group.
I guess I also wanted to ask, is this something that, say a young person has gone to their GP because they're concerned about their mental health or their well-being, if they have this, once they have this knowledge about how social prescribing works, is this something that they can like ask for? How does that work?
So social prescribing should be offered around the country.
Okay.
And there are often dedicated youth social prescribers. At the moment, a few areas are still patchy, but if it is something that young people are interested in, and they are accessing support via their GP, it might be worth asking if you could have a conversation with a link worker if one is available.
Do you have any recommendations for listeners if they want to find out more about this topic?
Sure. I think probably the best thing to do would be to follow our departmental website. It's quite young person friendly and forward facing. It's the Social Biobehavioral Research Group at UCL. That will be where we put up all the latest findings. We are actively collaborating with some young people. We've got 2 summer internships happening where they will be actively contributing to data analysis, and all the results will be published there in addition to more formalized ways such as journals and conferences.
Thank you so much for coming on today. Like, you've really cleared up a lot of the grey area information that's like in the news or online about what social prescribing is and how it works. So that's really helpful.
You're welcome. Thanks for having me.
Thank you so much to Daniel for coming onto the podcast today, and thank you all for listening. You can follow us for updates and more information on Instagram or TikTok at Science or Fiction Podcast, on X or Twitter at Sci or Fiction Pod. If you want to get in touch, or if you have a suggestion for a future topic, you can email us at info@scienceorfiction.co.uk or DM us on social media. And as always, you can find the researchers' recommendations and links to support at scienceorfiction.co.uk. Thank you to the youth advisory groups for their input on this series, and thank you to Kit Studio for the branding and Jamie Johnson for the music. See you next time.